Okay, good afternoon, everybody. As chairperson of the Jefferson County Department Board of Trustees, call the May monthly meeting to order. This meeting is being live streamed on YouTube as usual. Anyone who wants to watch. So I'd like to call the meeting to order. We have a roll call, please.
Mr. Deal,
Here.
Dr. Henry,
Here.
Mr. Prater,
Here.
Mr. Pig,
Here.
Ms. Davis.
Here.
Okay, all board members are here, so we have a quorum. And I'll start our meetings by reading our mission and vision statement. Dr. Henry?
Sure. The mission, JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County.
Thank you. So everybody should have received tentative agenda. So I have a motion to approve the agenda. Motion to approve. I'll second that. All in favor of approving the agenda as written, please say aye.
Aye.
Anyone opposed? Okay, so the agenda is approved. Two items to approve. First is the March 24, 2022 board meeting minutes. All of our board members were there. Have a motion to approve those.
Motion to approve.
Second.
Okay, motion second to approve those. Any discussion on that?
Mr. Chairman,
Yes, ma'am.
at the bottom of the first page, the last paragraph mentions me, it's inaccurate. It was stated that Ms. Coleman clarified the board governance fee has to do with most of the requests Ms. Coleman gets from Ms. Davis about Ms. Davis, the two compliance, including responding to emails that Ms. Davis sends to Ms. Coleman directly, or the emails that sends to the other board members or director. Ms. Davis, okay, this is inaccurate. It should be stricken from the minutes because I did come in and I looked over in great depth the legal fees and wrote down every single time I was mentioned, and it's been very, very minute number of times that my name was mentioned, and any time at all, hardly allotted to it at all. So this is inaccurate. It's a farce to try to make it out to look like I am running up the legal bills when I'm not. And I don't appreciate it, and it's inaccurate. I want it stricken from the record. And if that's not good enough, I'd like to have all those legal fees brought in here for the whole entire board to see and look at for the amount of time that has been allotted for anything that has to do with me. And I want this straightened out. I'm tired of things being said about me that are inaccurate.
Welcome to the club.
Ms. Davis, actually, the purpose of amending the minutes is to reflect that something that is in the minutes was not actually stated at the meeting, and that was stated at the meeting, so having it in the minutes is accurate. Whether or not you agree with the veracity of the statement is not something that's subject to amendment.
I understand. I just want that to be made known on public record.
Yeah. All information is available to any board member who wants to see it, so you know. Okay, so we have a motion and second to approve those minutes. Hearing no other discussion, all in favor, please say aye.
Aye.
Anyone opposed?
Myself.
One. Okay. The approval of the April 2022 expenditures. Half for those is $65,549.11.
Motion to approve.
Second.
Okay. Discussion on those.
Mr. Chairman?
Yeah.
On April the 13th, to Tom Ware, JCHD email protection for personnel, $8,113. I'm looking at that. In a moment, I'm going to ask if Ms. Vollmer would please explain that to us. I think I know what it is, but I'm looking at the lease that we paid for the building, the phone costs, the internet costs. Nothing is anywhere near that cost. Why is that $8,000?
Ms. Davis, that is a software service. It is for the protection of our health information. It's required for all of our information to be encrypted. So that includes our encryption and our protection, as well as the protection for our email systems. It's an annual cost. And so that is one full year. And that is due to the fact that our previous contract had expired.
What did we pay last year, for example? I'd like to know.
I can find that information out,
Appreciate
but it was underneath a separate contract.
And then on April the 28th, Lewis, Brisbane, Brindar, and Smith, our legal fees this month, $9,912. Looking at the legal fees that Chrissy Coleman has given us, it's not broken down again. I'd like to see it broken down, but here it says on the 20th that in regards to real estate concerns, 15 hours for $3,900. Like to know, what all that involved. On the 20th, again, the same day, we were billed $840 for a Robinson versus MDHS for 3 hours. I don't know how that can happen on the same day, but that's all right. We'd like to see.
It's daily invoices, Ms. Davis.
Okay, okay. And then on the 20th, another invoice for legal board governance, again, 15 hours, 15 and a half hours. And a sunshine that she had to look into, she says, for 1.8 hours. Again, $4,800 for 15 hours of board governance. Again, I'd like to see some details on that, Ms. Coleman, please. I think it's terribly excessive. And again, $9,000 a month for legal fees for a health board is unacceptable.
Mr. Chair, may I?
Yes.
Have the floor. I would like to object to Ms. Davis's continued badgering of all these bills when she has the opportunity to make phone calls, to talk to people prior to the meeting, but she comes in and wants a grandstand, make nefarious accusations, unfounded nefarious accusations that things are being misspent. Excuse me, I have the floor. I have the floor. I have the floor.
Yes.
I'm just asking.
I have,
questions.
no, you're not.
You
You do this all, excuse me. Excuse me, I have the floor. I have the floor.
I'm like.
I'm not the one who's committed fraud.
That's the floor, Ms. Davis.
I need
can
you to
speak.
call him out on that. He's not allowed to badger.
He's
I'm
not
sorry.
badgering you.
I'm a fellow
He's
board
making
member.
a
I'm
comment.
just.
I am
asking
making a
questions.
statement because you continue to do this. We've asked you plenty of times.
I am asking.
All right, so you're gonna
questions.
continue to interrupt me when I let you have your complete floor and say what you wanted to, but you want to badger me and not give me the opportunity to say what I need to. Again, I object to what you're doing because you're making it sound as if there are things going on in this health department that are nefarious, that we aren't being open, and you've been doing it since you walked in this door. And you need to stop and do things like you should by asking questions instead of grandstanding here and making things. You know very well that you can look at the detailed information behind closed doors, as we've explained to you plenty of times from the lawyer, but you refuse to do it. You keep coming here and grandstanding as if something's going wrong. And you are the only person on this board has done anything nefarious. You are the only one.
You're accusing me.
I'm not. I can go to CaseNet and see it.
I'm gonna allow this kind of behavior on our board. This is supposed to be a board meeting.
Exactly.
All right.
He's badgering
Would
me.
you like the floor?
Yes, I would.
All right,
Okay, I'm simply asking why the legal fees are so high. And we do, as a board member, all of us, we deserve to be able to see the detail of it, just like I had to physically make an appointment to come in, sit down and look at all these things. They were brought in here, I looked at them. Again, we're looking at 15 hours
everyone has
of
that
legal fees for
opportunity.
$4,000, almost $5,000.
Everyone has the opportunity to see the bills
So
as you.
I'm
yourself did.
asking to see what the 15 hours were for this month. How hard is that?
It's not hard.
Okay,
Why
because
are you
I've been
saying
accused
it's
in the past
difficult?
of being the reason that they
Ms.
were
Davis,
high.
did
And it
someone,
wasn't
did
me.
someone just file a sunshine law request that we have to deal with? You don't know?
1.8 hours, that's all that was for. The rest of it was
So you're
13
saying-
more hours or whatever.
All right,
I want to know what the
you
whatever
can
is.
look at the bills whenever you like. We don't need to do that during the board meeting.
Okay, well, I'll be up here tomorrow.
You can make an appointment.
Monday
You can make an
to see it.
appointment to do that
I
as
will.
usual.
I want to see, the
All
detail.
right.
Let me know when it's
so-
ready.
Can we call the motion, call
Yeah.
the motion.
So we're trying to approve the April 2020 expenditure. All in favor as written, please say aye.
Aye.
Anyone opposed?
Myself,
Next is approval of the April 2022 electronic payments. Actual amount for those was $476,098.30.
Make a motion to approve.
second,
Okay, so motion second to approve those. Discussion on those. Okay, all in favor of approving those electronic payments, please say aye.
Aye.
And opposed. Okay, finally, we have pre-approval of June 2022 electronic payments. Estimated amount for those is $592,022.25.
Motion to approve.
second,
Okay, so motion second to approve those. Discussion. Okay, hearing none, all in favor, please say aye.
Aye.
Anyone opposed? Okay. Next item on the agenda is the director's report.
It's fine.
Afternoon. You should all have a copy of the clinical services summary in your packet. So I'm just going to highlight a couple of items. Just for awareness, we are changing our electronic medical record system. So there could be some adjustments to the clinical schedule. This is something we've been working on for quite some time. Hoping that we can make that switch over based on the current. Also, I know this has been on the report for a couple of months, but just to highlight, we do continue to have open nursing positions. So just as an awareness, I know this isn't unique to us. It is something that most healthcare facilities are struggling with. But we do have 3 open RN positions that have been posted for recruiting or interviewing, working through that process. From the programs, I'd like to highlight that for family planning in the right time in April, our nurse practitioner for family planning and outreach and education nurse attended Jefferson College, the Pathways to Prevention event. This is a violence prevention project. It was a very successful day for them for outreach, and they were able to provide outreach to about 200 individuals. So I provided a picture there so you can see how they were set up. Also, just as an awareness, mobile wellness. So we've been under a grant called Access to Care from the initiation of our mobile wellness unit since May of 2018. So that came to an end in April, and we are continuing with our mobile wellness program. It's continuing to provide services in the community. You can see that In April, we visited 8 different locations and continue to schedule multiple locations across the county with our mobile wellness unit. We are transitioning a bit for that program and working very closely with Jackie's team for health disparities and trying to reach out to those individuals. Questions?
Good afternoon. I'd like to first bring your attention to our health network summary, and I just want to highlight 2 pieces. Under drug prevention and health education, I want to note that we started a new partnership recently with the 4-H Life program. And this is to expand services to youth who have an incarcerated family members. This is a unique new partnership for us. We're very excited. This is going to be great for our prevention specialists to work with these youth and also incorporate them into our teen coalition. I'd also like to note, under adult brain injury, in April, they did receive their annual contract monitoring, and they received some great positive feedback from our state specialists. And these services are essential to ensuring that participants and their families receive necessary services and supports to increase healthcare options for their level of independence. So one of those great programs we're happy to have. Under environmental, I do want to note that mosquito season is upon us. The county mosquito adulticide treatments, otherwise spraying, is projected to begin around May 26th. That is weather dependent. County residents may seek treatment requests by means of either calling our front office or looking at the JCHD website. County mosquito surveillance is to begin on June 1st, and county parks will be treated prior to the Memorial Day holiday. And municipal agreement treatments will be targeted mid-month and throughout the summer. Any questions?
Jackie, I just wanted to mention, in case so the public aren't aware of it, one of the other, or 2 of the other activities that are on the report are regarding lodging and daycare center inspections. So people may or may not know that we do that. One service that they help with.
Yes, we, our staff are out regularly working at child care facilities and lodging. So we have great services. We're really out working to make sure that our county residents and those visiting our county are safe for the eat.
Are you the person in charge of the animal rights?
I help oversee the program, and yes, most of the people help us.
They are, I mean, out of everything I was nursing on the church, seems like a large amount of animals.
They do tend to pick up a little bit this time of year as people are outside. It does tend to spring and summer, those numbers do go up a little bit. To some of the people. They do, at this time, they are looking similar to their numbers have been in the past.
Work with them.
Correct,
Sure
yes.
that
Yes, we do. We work very closely with animal control and with other counties and with the state to make sure that if there is a bite, that quarantine, they're tested for rabies.
So if someone's fired one of our plants, so they're not like to leave report to the employees.
So
Maybe there's lots of dog.
So yes, within the animal bite program, they do, those are reported accordingly and again, they're investigated. Thank you. Anything else? Thank you.
I'm good spot. Yeah, so my name is Gina, I'm the preparedness supervisor, and we have a presentation for you today. I wanted to start with those of you that have the PHP, the actual packet. Just wanted to go over that front chart again. I know Kelly's mentioned it before, just on how to read it, and just talk a little bit about how these dates come through and the cases come through. So when the cases are reported to us, they normally come through and are tagged in our system from the date that the specimen collection was collected. It may take a few days for us to get up. So sometimes it may be March 31st that someone comes in for a test. It's April 1st or 2nd when we get notification, and we start our investigation. So sometimes we look at our monthly numbers and they might look a little smaller or larger than other months. A lot of that is because they came in at the end of one month when we're investigating into the next. The other piece is that as we do our investigation, our Eastern District EPIs through the state will follow up behind us and actually audit the case, and they will be the ones that do the final confirmation of whether it's confirmed, it's probable, or suspect. So sometimes we will have pending cases that have completed their investigation. We know they're a case, we're just waiting for that confirmation to go over. So we are going to give a presentation on One Health, and this is a project we're really excited about. Soon you'll see some our marketing education coming out from our communications team that we'll be pushing out, and we just wanted to give an awareness to this group as we start that process. So I'm gonna let Sarah Wilton, our EPI, take over.
So let's start with what is One Health. One Health is both a concept and a movement. So One Health as a concept, it's the interconnectedness between human health, animal health, and environmental health. That the health of one part of the triad affects the health of all. So the One Health movement involves working together to improve the way that we're interacting with the natural world by educating, advocating, and reducing our footprint. It's a collaborative effort of multiple disciplines to attain optimal health for each part of the triad. A One Health approach is going to bring together experts in all of these different fields to address shared health threats and overcome health challenges that face all of us. Next slide, thanks. So what are these health challenges that I'm talking about? Essentially, One Health addresses the greatest threats to health worldwide. And some of those include climate change, emerging infectious diseases, pollutants, and loss of biodiversity. So for anybody who doesn't know what biodiversity is, it's a term for the variety of species that make up a particular habitat. So animals, plants, fungi, the variety of life that make up basically the natural world. And since 1960, actually, humanity has wiped out about 68% of animal populations, which means right now we're losing species at a rate not seen since the loss of the dinosaurs. So the loss of biodiversity really is something that we need to be concerned about. So these are huge threats, obviously, to tackle, but let me explain why One Health matters and how it affects all of us. So we live in the era of the Anthropocene, which means it's a time where humans are the drivers of change on Earth today. So our actions are changing the dynamics of the Earth's system and causing some irreversible damage to the natural world. So up on the screen, you see that's a picture of the Great Pacific Garbage Patch, which is basically a gigantic collection of trash in the ocean, twice the size of Texas. So it's not biodegradable. All of this debris is really harmful to marine life, and it could eventually have an impact on our health as well. So many of the diseases that our communicable disease team work with on a daily basis are what we call zoonotic. So that means it can be passed from animals to humans. So think of Ebola, rabies, Zika virus, among many others. About 60% of infectious diseases in humans have a zoonotic link. So this is important because, go ahead, next slide, thanks. No, you're good. Because the drivers of emerging infectious diseases, which is one of those main health threats, are universally caused by human actions. So all of those different actions that you see up on the screen there. Anthropogenic changes are what allow for what we call a spillover event. So to put that more simply, when we change how we interact with the natural world, that's what causes diseases to potentially spread from the place where they were living dormant, not really causing any harm, just peacefully existing, to now affecting people. So the problem is not that these diseases exist and are out there or even in our food animals, but the problem really is that were disturbing them. So there are hundreds of thousands of potential pathogens that exist undisturbed in the jungle and in the forests. So really, it only takes one little moment and perfect chain of events to cause one of those pathogens to spill over into the human population. And using One Health is really just a bridge to combat those spillover events. We need to be aware of how our certain human behaviors, such as deforestation or expanding into new geographic areas, encroachment on wildlife habitats, even consumption of wildlife, how all of those behaviors create opportunities for new diseases to spill over and disrupt the natural balance of the ecosystem. So by doing our part, working with the experts in other disciplines, we can actually protect the health of not only us, but all three parts of that triad. So to give an example of why One Health is important to us here in Jefferson County, we're going to highlight some of our tick-borne diseases that are extremely common here, especially in the upcoming summer months. So I'm assuming that most everybody, if not everybody in this room, has probably had a tick on them at some point. Well, here's hoping that nobody has actually gotten ill from that tick. But it does happen often here in our county. So several factors that I mentioned earlier have contributed to the increase in tick-borne illness around here. Land use changes can impact a tick's geographic range, and decreases in the diversity of wildlife in an area has also been linked to increases in some tick-borne diseases. So now I will hand it off to Gina again, who's going to explain a little bit about the specific tick-borne diseases that we see here in our county.
So I did not get this one in our slide or in our packet, but this just shows these are our main tick-borne illnesses that we have here in Missouri. So anaplasmosis, ehrlichiosis, Rocky Mountain spotted fever, and tularemia are ones that are dominant in Missouri. You can see that Lyme, I think, has like one dot in the Kansas City region. And I have another one in your packet. So I went through each one. Sorry, we're on two different. Just to go through each tick-borne illness that we have in Missouri. And the one I wanted to kind of point out that confuses folks all the time is Lyme disease. We do not have the bacteria that causes Lyme disease in Missouri. So I hear people tell me all the time, I have Lyme disease. My doctor said I had Lyme disease. We have Lyme-like disease in Missouri. It's still a bacteria, but it is not the exact bacteria that causes Lyme disease. So you can be a Missouri resident with Lyme disease, but you contracted it from travel somewhere else. That's the big one that confuses folks a lot. So unfortunately, I feel like most everything we do in our department has the same types of symptoms. So fevers, chills, aches, pains, and a rash. Anytime that you have had a tick bite, you found it on yourself, and you start to feel ill in the next 24 hours, you need to notify your medical provider what's going on. They may have you come in, but you want to be aware of that.
Question. So you get a tick bite. What's the best thing to do? So grandma and mom told us things, but what do you say?
So I think I put that in the packet. So the best case scenario is to remove it under 24 hours. The fastest you can get it out.
Remove it, but then what? What do you do that spot?
You just want to clean it really well. So you want to pull it off, use your tweezers. You don't need fingernail polish remover. I can't remember all things I've been told in my whole lifetime. You want to use your tweezers, pull it off nice and firm. Make sure you get all of it there. You want to clean that area. And then just monitor them. Tick-borne illnesses are reported to the health department, so we will receive that through lab reports that come to us just like any other disease. There are folks that still call in, and that's fine too, but we will be notified, I think within 24 hours of when those come through, and we will give you a call. I'm gonna keep talking, get totally ahead of myself.
I think you're.
Yes, right. Yeah, right. Oh, I sent you the wrong one. I apologize. So we're gonna get that information and we're gonna give you a call. Tick-borne illnesses are not transmitted people to people. So you're gonna get it from that tick and you're gonna hold it. That's not gonna go any further than you. So you're not gonna be the first one on our call that morning, but we are gonna give you a call. And we are going to provide you with that education and knowledge of what's going on. So most likely you go to the doctor, told them that you had a tick bite, they've ordered a tick panel, they come back and say you're positive for this, they're gonna start you on a treatment, probably doxy, an antibiotic, if it's appropriate, and it's gonna be the most of the information. So we're gonna call you and we're gonna give you that education on what that tick bite means and what that illness means and what to expect. The other thing we're gonna do is we're gonna ask some questions about what your symptoms were. We use that information, it goes up to the state, and really the state's gonna use that. Conservation Department or parks, they're gonna use that to see what illnesses, what diseases are prevalent in areas, and that will be a driving force for programming and how we move forward in the future. So that data is really important to us. So hopefully, if you get that call, please know we're not gonna be super intrusive. We just wanna give you some education and get a little bit of information so that we can try to protect better in the future.
Do you have any information on the actual numbers of ticks being reported? Because personally, I noticed there seems to be a lot of ticks, or they're just seeing a free meal walk by and jumping on it or something, I don't know. But it just seems like I've been attracting more than normal this year.
I feel the same way.
Okay, so I don't, again, is it just because are they more prevalent this year? Or do we know?
I'm not
I don't
sure
know if
about
we
the
have a-
prevalence, we can look that part out. I don't know, a lot of times weather has to do with it.
It's been wild.
It's been rough. One thing I forgot is, our pets, our cats, our dogs, our animals that are in the house, talk to your vets. There is treatment for them to prevent them from either getting ticks or from keeping them from bringing them in live to you later. Because that was lovely.
I
But yes,
appreciate that, because like I said, I've noticed at least around my area, it seems to be a whole bunch more.
yes.
I think there
Yeah,
are
like
some
cedar
really good
trees.
information
Yeah.
sheets in the packet. So are those going to be on
Jump
the
on those.
website for people to see?
It's funny that you say that. We actually have a campaign with how to remove them properly and pull all the stuff out. So that'll be coming out soon too.
Okay. good.
Yeah, and there are some, and I know that on the paper, you don't have the links, DHSS has a really good PDF on ticks. It's about 50 pages long, so I didn't print it off for everybody. But really good, easy to follow information. The CDC website is really clear on that information. So there's a lot out there. And I kind of feel like I stepped on Scott's toes because ticks and mosquitoes are normally his, but we share these. So he's got a lot of information too in handouts.
Thank you very much,
Going under
ladies.
cedar trees.
Yeah. Yes.
You see them hanging out the branches.
Thank you.
ladies.
Thank you.
Do you have anything else? Kelly?
No,
Okay, so this is on the agenda. New business is state contract campaign budget.
just to give the board an update of the adult brain injury in the children and youth with special healthcare needs budgets are approved at the beginning of the year. Those contracts usually run July 1 to June 30th, to making sure I got my dates right. And over the course of this past year, we've had a position vacancy in each of those departments, as well as with COVID, the state had restricted in-home visits for a period of time. We do get reimbursed for travel and in that department as well. And so with that, we had additional funds left in our budget at the end of this year. We've spoken with the both the contacts at the Children and Youth with Special Healthcare Needs and the ABI programs and requested to be able to take those additional funds and reallocate them within our approved budget just to a different line item to do some marketing and education with our community. One of the things is those programs serve more than just Jefferson County. They serve several counties. And so being able to do a increased campaign, which would include billboards, digital ads, and social media ads. And again, increasing the awareness of the state contract programs and services that are available to those families. But at this point in time, what I had asked is I had asked for written approval from the program to say, yes, you absolutely will be, this is okay for the change in the line item. We have received that currently from Children and Youth with Special Healthcare Needs. ABI is in the process of getting back with us. They had a question or two, so we're in the process of answering that. But we wanted to make you aware that we were going to be transitioning those funds from the transportation and salary line items over to the marketing line items in order to be able to utilize them prior to the end of the contract on June 30th.
So the money is to be spent by then?
Correct. Excuse me. Did you? They just gave their approval, so we have approval from both to be able to get reimbursed. But that makes me feel better. We like to have it in writing. So we have approval from both of those programs, but just wanted to make you aware because we are, I believe that I'm trying to see if it was the radio campaign or is it
Which one?
for that is over the 5,000.
Oh, the digital ads.
The digital ads, which will be targeting all 6 counties that we are reimbursed for with a total of 600,000 impressions. And we will have it for 3 months. And so that was over my 5,000 that can go ahead and do the approval for. So wanted to make you aware that the program, this was within the budgeted or the approved budget. And we actually have now received approval from both programs to realign those line items to digital marketing. So you'll see that likely on the next, trying to think if that'd be on the next invoice or the invoice after next month's bills.
Speaking of marketing, I saw the billboards went out. Do you guys have any responses from anybody on this?
Sorry.
Responses as in like an increase in testing or anything like that. So I don't know that off the top of my head. I can check with Melissa. But that is the desired outcome. So, but we're also going to be, that was kind of like the beginning piece. We're also going to be at like the DeSoto Farmers Market in a couple weeks. We're going out to a couple different community events to actually provide that testing like in space or not in space, in that space for folks. So June 18th, if anybody's got some little kiddos, bring them to DeSoto Farmers Market and we'll get them tested. So
I'll be playing golf that day.
Watch out for ticks.
Yeah.
That's all.
Do we have a visitor?
Oh, yes.
Oh,
Sorry.
this is Tristan. He is our new communications specialist. He just started on Monday. I've been very excited to have an individual to help. So this is him. This is Tristan.
Hello.
I'm Tristan.
Do we have anything for closed session?
Mr. Chairman, in regards to new business, I have a comment. I did a little study. I called St. Louis County, Franklin County, St. Charles County, and other surrounding counties around us. And I listened to their voice message so that when you call in what it says, and there's no mention of COVID whatsoever. I think one of them mentioned it, but it was at the very end of the message. And if you guys don't believe me, go ahead and do this yourself as well. But I think that I've mentioned this before, but we should consider as a board that and our director too, is this is an endemic phase now, and there's a lot more information, a lot more that we do as a health department that our people are looking for when they call in, and it would be nice if they could just get right to it, go right to what they need information on instead of having to hear on our message. It says for about 2 minutes, if you need this regarding COVID, if you have a positive, blah, blah, blah. And I looked at it, took 2 minutes. I encourage the rest of the board to call into the health department. You can do it right now. It'll take 2 minutes before you can even get into any other information on what the health department will do for you as a citizen. So that needs to be looked at. And
Ms. Davis, may I respond to just that one point? Thank you. So if you'll notice on our analytics from the communications webpage or within our reports this month, over 5,000 individuals came to our site and the Hyatt regarding COVID data. That's actually more people went to the COVID-19 data and COVID-19 information sites than hit our homepage. The next most clicked site was events, which we're down in 709. We have a tremendous amount of individuals from the community who are still seeking information on COVID testing, COVID vaccinations, and additional information. And so what we have done is we've provided that information up front in order to allow our office support assistants to be able to provide information and be able to answer calls for the clinic. That way individuals can hit the numbers and are allowed to, are forwarded to accurate information, which is timely, and it reduces the amount of calls coming into the front office.
Did you say 5,000?
So I have,
13,500. So I just wanted to clarify that.
are you on, sorry, I'm looking on the bottom
HD
page.
Oh, no, this-
Oh, you're looking at the
The actual
actual
page.
page clips.
So
So yes,
I have maybe a side
Is
follow.
it any different in Jefferson County and St. Louis, County, Franklin County, Charles County? I mean,
Is-
they're not,
That's what I was thinking.
Make it an option, make
Why
it
can't we
number
have a
9 or
prompt? Why-
something.
Well, maybe not number 9, but can we,
If you need
if you want to talk
anything.
about this, one, if you need this, 2, can we make it a prompt? instead
So
of-
I'm actually in the process of
Okay.
redoing that,
Okay.
especially since we're gonna have the app
Okay,
launching here, hopefully in a couple weeks. So we'll definitely.
so
wanna put
prompt
that-
it out.
Yeah,
instead of
for
it-
sure, for
Okay.
sure. The goal would be to make it quick, easy,
Mhm.
so folks know where to get that.
If
But
they wanna
again,
go and
there
listen to what They
is,
choose to do. and then
yeah,
if not,
there
they
is
go
some
to-
value in kind of lining that out at the get-go.
Mhm.
Or otherwise people like my dad get frustrated, they just keep hitting 0 and then our ladies up front get to talk to people like my dad.
Exactly.
So yeah.
So
that's
we're
definitely
in the
something we're gonna
process
change.
of that, but it is a process.
Yeah.
it is extremely aggravating for people, especially older people, when they call here and they have to listen to that for at least 2 minutes first before they can get what they need. So again, I'm saying if that's still going on, fine, put it on as an option at the end. like the
Susan, they
rest of
just
these
said
guys are
that
doing.
it's all done. So move along, what's
All
next?
right, well, by next month, this shouldn't even be an issue then. Okay, and then the other thing is, why, and then while I was on the phone with these counties, every single county had to deal with COVID like we did, and I know we worked hard, our staff worked hard, and we appreciate them for that. But no one else on any of these other counties are off on Fridays. They work Monday through Friday, 8 to 4:30, or 8 to 5, whatever. And we're off on Friday, and I want to know why.
I'm more than happy to answer that for you, ma'am. So we currently are operating at just over 50% of our nursing staff. We have had positions posted since July of last year. We have 3 open positions. We have seen a significant drop in the number of individuals who are applying for positions. We have also had, in terms of, it used to be we'd have maybe 15 individuals applying for a position. That number has significantly dropped. And then now we are also having a number who are who are sending in applications who either are not qualified or they withdraw because of once they find out what our pay is, or they actually have decided to sign on with a different agency that has sign-on bonuses, which we are not allowed to do.
$15,000 sign-on bonus
Correct.
on a billboard on 55.
It is absolutely difficult to get it. So as I was, couple of the things that I brought in response to that was Missouri Hospital Association just put out a report today about staff turnover in the hospitals has hit an all-time high. And that vacancy in registered nurse positions, which is what we utilize, is hit 20% this year, which is the highest level in 21 years since the association has conducted the survey.
Because they work for they made them get
So,
vaccinations,
Ms.
they
Davis,
got-
if I can finish, thank you.
I know.
So one of
do
the
other
other
things
pieces, Ms.
besides
Davis, if
that,
I may
though.
finish, thank you.
Okay.
So as far as our staffing is concerned, we do not have enough staffing to actually have full service clinic in all 3 of the office locations and on our 6 mobile units to be able to cover 4 days a week. One thing I would like to point out is that all of our executive staff, as well as numerous other programs, including environmental health ed, dental, and public health preparedness, all work outside of the normal Monday through Thursday, 8 to 5:30 time period. So you will find that we're having water testing, vector-borne investigations, our individuals are out doing inspections at temporary events. Our health educators are working at the DeSoto Farmers Market and providing health and wellness services. And so our staff are out evenings, weekends, and beyond those normal hours. The executive staff, I can tell you, has not worked a 36-hour week or a 4-day week in over 2 years. And all of those individuals you will likely find in here, even though the offices are closed to the public on Fridays, you will likely find them in here on a Friday, a Saturday, a Sunday, a holiday. And finally, what I would like to reiterate is that we cannot force people to come to us to work. We can do what we can with the resources that we have. We have really restructured our programs in order to try to optimize the number of staff that we have available to be able to ensure we're providing services throughout the county. We're really having to lean on our mobile in order to ensure that all of the areas of the county are being taken care of. But our nursing staff has really endured. One of the things that has been a factor in healthcare worker burnout, which I've got some information I'll share with you guys today, is the simple fact that having understaff and working additional hours, having the mental health pressures, as well as the disconnect in terms of excessive workload, work hours. It's just been a mental strain on all public health and healthcare workers. And so you're seeing this across the board, enough so that the Surgeon General of the United States has just issued a statement and has issued an advisory about healthcare worker burnout. So all of those things coming together have really impacted our ability to be able to cover 5 days a week, Monday through Friday, but we are definitely out there. Our priority has been to take public health outside the four walls of our agency. We have 3 office locations, which are available to the public, as well as 6 mobile units. We are in the community, we are providing services, and I can guarantee you it's not just Monday through Friday, 8 to 5:30.
So, Ms. Vollmer, somebody that's not paying attention and it's Friday and that's the only day they have to come up to the health department to, I don't know, get whatever they need for whatever it is that they're here for, they're gonna have to wait till Monday to do that. That's not fair to them. When we're being paid, we've got office staff. We don't have to have enough nurses to be open on Friday. All the rest of these health departments are open Monday through Friday.
And do
Why
they
should
have
we be any
3
different?
office locations and
That's all
6
I'm
mobile
saying.
units that they're staffing?
You know, we should not be any different. We've got a lot of paid staff.
Miss Davis, we are
And I know they
different.
do work
We have
other
more
times than
access sites
sites
and we
here.
have fewer
But our
staff
offices
that we are
need to be
working with.
open for the public to come in to get what they need.
Our office is open Monday through Thursday, 8 to 5:30 for any of those particular
to
services,
be
as
open
well
on
as the
Friday.
staff can, Miss Davis.
And
The
I know
public
you don't
has
agree, but
access to our
that's-
services.
This is what the constituents are coming to me with, and this is what I'm bringing in front of the board.
Well, as a board member, I would find it very helpful if you could educate the constituents that are coming to you that we are
They just
available
don't
8
like
to
show up
5:30.
on Friday and not be, the office isn't open. I needed it to be open Friday. I needed to come in and get a temporary permit for a food service that I needed to do. Couldn't do it.
Well, since all of our providers and our individuals who usually come get temp permits know that we are open 8 to 5:30, Monday through Thursday, and then if they have a weekend event that they should come in on.
Why
before
are we
that.
any different than the rest of the surrounding counties
We are
that
very
are
different.
open
Ms.
Monday
Davis.
through
We're
Friday?
very different.
We need our doors open for the public Monday through Friday. They're paying for
Could
the
we close on
services.
Old High Ridge
they
and
need
just
to get them
staff
when they need
mobile vans twice a week?
Yes,
And then keep this place open Monday through Friday?
absolutely. We would have enough staff to do that,
Do you
yes.
think that would provide a better coverage than having all 3 offices open Monday through Thursday?
Yes,
This is hypothetical talk, not.
correct.
Have the main building here open Monday through Friday, so people can count on it.
So are you
So-
stating that you were in favor of closing the High Ridge and the Arnold offices?
People don't think about going to those offices like they do coming here. This is the main one.
Okay, Ms. Davis,
It's an
you've never
assumption
run
on
a
your
large
part.
organization. You don't understand the complexities of what you're talking about. And I apologize for saying it that way, but you don't.
You can't judge what I know.
Well, I can
and
because
don't know.
because you wouldn't be
Please,
talking
back
about
off
that.
me.
You wouldn't be talking that way if you understood the
We're-
complexities. We need to, did you not hear, we're 50% down on staffing in nursing? Did you just not hear her say that?
We do other things besides get people in to see a nurse here.
I
in this
understand
building.
that.
Lots of
yes.
other things.
Really, I'm surprised you understood.
Ms. Davis, what are
Yeah.
3 things that we do aside from nursing
Well,
that you didn't hear about today?
what we do, we come in here as caterers and need temporary permits, things like that. We also need birth and death certificate things that we have to have like that day because somebody's needing it, an attorney or somebody, whatever. Those kind of things. You do a lot. Water samples.
Water samples are conducted on Friday. And the
Friday?
testing is done.
On
Those
Friday?
individuals
What do
who
they
need a,
take?
Ms. Davis, the water samples, if you would have paid attention during the walkthrough that you were educated on, we actually have a time period that those water samples have to run through. And so in order for them to be fully processed and to be able to read them, they're taken in as late as they can be during the week, which I believe is a Wednesday, and then they can be read by Friday. So-
On the website too. for
I've
folks
let
that-
y'all know
Correct.
that everybody else is working Monday through Friday, so I've done my part. That's what I did.
Thanks, but I think
There's gonna be hundreds of excuses why not to work on
these are
Friday,
not
but everybody else is
excuses,
working
Ms.
Friday.
Davis, they're explanations for why we do what we do. There's a trade-off between
Kelly.
focusing on one.
The other counties
very
have the same
specific-
situation.
Bring
we
it like
do.
a third.
That's very, very
And they're open on
untrue.
Friday.
Yeah.
None of the other counties do the amount of services, the amount of in the community services and presence that we do. I can tell you that because I've either worked for them or I've respected them. And so you're making false statements, Ms. Davis.
No.
And, it's very
Not being
unfair.
false. There you go
Very
again,
un-
trying to accuse me of being false.
Very
I call
unfair
every single one of
for,
them. They all work
very
Monday through
unfair
Friday,
for
right
you
here.
to compare
get
one
copies of this.
specific
Don't call them
issue
too.
and then say that every health department is the same.
I
There's been a saying in public health for years in Missouri that if you've seen one health department, you've seen one health department. And that is because every health department is different. They have vastly different numbers of citizens in their counties. They have vastly different numbers of personnel. They have vastly different amounts of budgets, of services. For you to say that we don't do what other health departments do is actually
I said that.
totally.
I thought you just said
Yes,
that.
you did.
I would be interested, Ms. Farmer, could you do me a favor? Would you do us a
So I
favor?
think
Would you call these,
Why
would you
don't,
call these
why don't
same
you
people?
just call the question? and-
I would
What
like,
you have to do.
there is nothing, you brought up a whole new subject, which we shouldn't even be on, but I'm gonna request that you go ahead and call these same people that Ms. Davis did.
Please take. a
And I
copy.
would, excuse
Call
me,
each one.
again,
That'd be
I'm
great.
talking, can you let me finish? And go through and ask what service they providing during these timeframes? Exactly, because I think it's a very important discussion to find out what services are they providing? What are they doing Monday through Friday? Because if they're not providing the same level of services we are in this situation.
Also, we get a day off
So-
and they don't. That's the whole
Ms.
point.
Davis, that's
That's the
not
whole
just
point.
untrue, it's
The
unfair.
constituents keep coming to me and saying, why?
Ms. Davis, we all
So,
have
why?
constituents, which actually are every citizen in the county. You
So-
don't have
I
your.
keep having
constituents.
constituents ask me about you and why.
Do the medics get a day off? Do the doctors and the nurses get a day off?
Mr.
Yeah.
Chair,
They're in the
can I,
trenches.
one of my staff would like to ask, or
You know what I'm
have the
saying?
board for
They
just a
have
moment, please.
dedicated days off, yes, but are the hospitals open?
Ms. Davis,
Monday
can one
through-
of my staff please speak?
7 days a week? Yes.
Are you, is that possible? Thank you. Fran?
So I just wanted to clarify some of the things too. So though the physical offices may not be open on Fridays, a lot of the services that you were just referring to, Ms. Davis, are still available. So vital records and whatnot can still be done online. That's on our website, and it will be available through our app as well, which I'm really excited about because that'll put that accessibility in your hand in the drive-through at McDonald's, you know, when we think of the things that we need to do. Also, the temporary permits also can be done online. So if that's something that any individual or,
I'd like to have that link.
so if you go to our website
Website.
and just visit the environmental tab, it'll have all of the information there. It'll have the temporary food permit. It'll have the, there's a requirements list there for in case that's something that someone needs. It has our annual permits, all that stuff. They're all downloadable. Most of them are fillable. The ones that aren't, I'm still working to convert so that you can literally pull it up on your phone, your tablet, wherever you're at, fill it in. And then usually at the top of those, it'll tell you the email address to send it to, save it to your phone, your device, pop it right to us in an email, and you're good to go. So, and again, that will also be something that's available during, I keep talking about this app, but I'm very excited about it. When the app comes out, that'll also be something that's available there as well. So the goal is to make sure that there are no services, there isn't something that someone needs and they can't access. I'm one of those folks that are here on the Fridays. So I've had a couple folks that like, they come knock on the door and I can see them through my window. So I'll go out, let them know. And I'm like, hey, you know, we're not open for services today. Is there something I can help with? And they're usually looking for the county administrative building, which you get to tell them it's down the road. So I just wanted to make that one clear too, that there's, just because we're not physically in the building on Friday, we still have a lot of those services available. Or ways that they can get that. I highly encourage folks to visit the website if they have not yet, because it is a wealth of knowledge and it is a very interactive space. You can get a lot of the things that you need. So I just wanted to throw that out there. Thank you.
Okay,
I
thank
would
you.
like to make a motion to adjourn the meeting because
Yes.
this isn't even on the agenda.
Do we have, I already asked you. One second.
No.
Okay.